Hi everybody, I'm Dr. Jordan Williams. Today's 3-minute injury report is about groin strain, how it happens, and what you can do to help prevent and fix it. Groin strain. How does that happen? Well, there's lots of ways that it can happen. What we most often see in the clinic is you strain your groin from sprinting, from pushing too hard, or from when you're really tired hiking and you start to push through some of that pain and irritation because you're trying to get to that last mile, you're trying to achieve a certain mark, and your hips are getting really tired, your quads are getting tired, your hamstrings are getting tired, and the only muscle that you have left to be able to propel yourself forward is the groin muscle or the adductor muscles. Let's draw it out. So the groin muscle or the adductor muscles attach right about the knee there, and they come up and attach to the pelvis. Those muscles, normally they draw your leg from the outside to the inside, or from lateral to medial. But they do this crazy thing, when your legs get really tired, they can actually bring it forward if it's back, and they can bring it back when it's forward. So if you're really tired, or if your muscles are not warmed up properly and you're sprinting, this muscle gets really strained, and it can get overworked and overused, and it can be really quite painful. So what can you do about it? Well, let's chat about that. There's a few exercises that you can do to really target some of the groin muscles in order to help them get nice and strong and not be quite so painful. The first exercise that you would do would be sitting on the edge of a bench, edge of a table, edge of your, anywhere that you have your feet up off the ground, and you're rotating that foot out and then back in, out and in. Really just trying to stretch that muscle a little bit and then engage it. Stretch and engage. This is really working the rotators, but as you do this motion, it stretches this muscle a little bit more. The second one that you would do is going to be lying on your side, and it's kind of an awkward position, but you straighten the bottom leg, cross over the top leg, and then you're lifting the bottom leg. When you do this, you're actually going to feel both the groin muscles engage in order to help stabilize you. This one, again, is something that you want to do to the point where it's a little bit uncomfortable is okay, no super sharp pain. The last exercise that you're going to do, again, is lying down, but you're going to be on your back this time. You're going to rotate that toe out to the side, keep your leg nice and straight, and then you're lifting up and back down. You don't have to go super high, just lift up to the opposite leg there and back down. Do each of these about 10-15 times, and do 2 or 3 sets on this. A couple times a day, just getting those muscles working is going to be helpful, and do them for a couple of weeks. If you do them for a couple of weeks and things are starting to get better, we'd love to hear about it. Drop us a comment in the box below. If you do them and you're not doing a whole lot better and you're kind of struggling with some of that, we'd also love to hear about that, because we'd love to be able to get you into the clinic and get you pain-free so you can go back out to sprint, run, and have fun without pain. We'd love to hear from you soon.